Your feet are trying to tell you something. And if you've been ignoring the tingling, the numbness, the strange color changes, or the wounds that just won't heal, your body may be sending you one of the most urgent warnings it knows how to send. Because here's what most people don't realize. Diabetes doesn't always announce itself with a dramatic symptom. It doesn't always come with chest pain or a sudden collapse. In millions of people around the world, it whispers. And it whispers loudest through your feet. Right now, over 400 million people worldwide are living with diabetes. And shockingly, nearly half of them don't know it yet. They're walking around, literally, with a disease that's silently damaging their nerves, destroying their blood vessels, and setting them up for outcomes that are entirely preventable if caught early enough. Outcomes like foot ulcers, infections, and in the worst cases, amputation. I'm Dr. Chester. I've sat across from hundreds of patients who came to me with a foot problem, a blister that wouldn't heal, a foot that kept going numb, skin that looked strange. And what we found underneath that foot problem was undiagnosed diabetes that had been developing for years without a single obvious symptom. This video is about those early warnings. The 9 signs hiding in your feet right now that could mean your blood sugar is dangerously out of control, and what you need to do about each one before the window for easy intervention closes. And before we go any further, if you've landed on this channel for the first time, go ahead and subscribe. This is where we cut through the noise and bring you real clinical information that can genuinely change your health outcomes. Now, let's talk about your feet. Why feet? Why does diabetes show up there first? Before we go sign by sign, you need to understand why feet are ground zero for diabetic damage. It's not random. It's biology. When your blood sugar stays elevated for extended periods, even mildly elevated, even in what doctors call the pre-diabetic range, 2 catastrophic things begin to happen simultaneously in your body. First, your nerves start to deteriorate. Chronically high glucose is essentially toxic to nerve fibers. It damages the protective coating around nerves called myelin, and it impairs the small blood vessels that feed those nerves with oxygen. The nerves that die first are the longest ones in your body, the ones that run all the way down from your spine to your toes. That's why your feet feel it before your hands. That's why your toes go numb before your fingers. The distance from your spinal cord to your big toe is the longest nerve highway in your body, and it's the first one to suffer when blood sugar runs chronically high. This nerve damage is called peripheral neuropathy, and it affects approximately 50% of all people with diabetes. 50%. Half of everyone with this disease will develop it. Second, your circulation deteriorates. High blood sugar damages the walls of your blood vessels, making them stiff, narrow, and prone to blockage. Your feet, being the furthest point from your heart, receive the worst of this reduced circulation. Less blood flow means less oxygen, less immune defense, slower healing, and more vulnerability to infection. Put nerve damage and poor circulation together, and you've got a perfect storm. You can't feel the injury happening, and when it does happen, your body can't heal it properly. That's the biology. Now here are the 9 signs. Sign 1. Numbness or tingling that comes and goes. This is the one most people dismiss. They feel a strange pins and needles sensation in their foot or toes, maybe when they're sitting, maybe when they wake up in the morning, and they assume their foot just fell asleep. And sometimes it is just that. But when this sensation becomes a regular visitor, when it shows up multiple times a week without an obvious positional cause, that's your peripheral nervous system raising its hand. In early diabetic neuropathy, the small nerve fibers that detect sensation begin sending erratic, misfiring signals. The sensation feels like tingling, buzzing, or the classic pins and needles. Because the nerve is still alive, still firing, but doing so incorrectly. Here's what makes this sign so dangerous. It's easy to live with. It doesn't stop you from walking. It doesn't keep you up at night. You can function completely normally while your nerves are quietly being destroyed. Many patients tell me they had tingling in their feet for 2 or 3 years before they mentioned it to a doctor. And by the time they did, the neuropathy was already moderate to severe. What to do? If you experience tingling or numbness in your feet more than 2 or 3 times a week, especially if it's in both feet, especially if it's worse at night, get a fasting blood glucose test and an HbA1c done. Don't wait. Sign 2. Burning pain, especially at night. This one is harder to ignore, but people still try. A deep, burning, aching pain in the feet and lower legs that gets worse when you're lying down, when the room is quiet, when there's nothing to distract you. Some patients describe it as feeling like their feet are on fire. Others say it's like sunburn from the inside. Some say it's a stabbing, electric pain that shoots through their toes randomly, unprovoked. This is a classic presentation of diabetic peripheral neuropathy, and it represents a slightly later stage than the tingling. What's happening is that as the nerves continue to deteriorate, they begin generating spontaneous pain signals. Your brain receives the message that something is burning your foot, but nothing is. The nerve itself is misfiring, creating pain out of nothing. Nighttime is worse for a simple reason. During the day, you have competing sensory input, the feel of your shoes, the floor, the busyness of movement, that partially masks the nerve pain. Lie down in a quiet room, and suddenly there's nothing competing with those misfiring signals. The pain becomes all you can hear. What makes this particularly diagnostic for diabetes is the bilateral nature, both feet or alternating between both feet. Pain that affects only one foot is more likely to be a structural issue, like a pinched nerve or plantar fasciitis. Pain in both feet simultaneously, burning in nature, worse at night, that pattern has diabetic neuropathy written all over it. What to do? Do not self-medicate this with pain relievers and push through. This is your body asking loudly for a blood sugar check. See your doctor. Sign 3. Loss of feeling, the silent killer. Here's where it gets truly dangerous. In some people, the neuropathy doesn't cause burning pain. Instead, it steals sensation entirely. They progressively lose the ability to feel heat, cold, pressure, and pain in their feet. And here's the terrifying part. They often feel relief. The tingling is gone. The burning is gone. My feet actually feel better now, they tell their family. They don't feel better. They've gone numb. This is the stage of neuropathy where the catastrophic consequences of diabetes begin. When you can't feel your feet, you can't detect injuries. You can step on a nail and not know it. You can develop a blister from a tight shoe and walk on it for 3 days before you notice it. You can burn your foot in hot bath water because you couldn't test the temperature properly. I have had patients come to me with infections so deep they had reached the bone, and they had no idea because they felt no pain. The wound had been there for weeks. They found it by accident, looking at the bottom of their foot while changing socks. This is called loss of protective sensation, and it is one of the most serious risk factors for diabetic foot ulceration and amputation. Research shows that people with diabetes who have lost protective sensation are 7 times more likely to develop a foot ulcer than those with intact sensation. What to do? Test your own sensation right now. Take a thin piece of tissue paper or a light feather. Close your eyes. Have someone brush it across the bottom of your foot and tell them where you feel it. If you have patches where you feel nothing, see a doctor this week. Sign 4. Wounds or sores that won't heal. A healthy person gets a small cut on their foot. Within a few days, it starts closing. Within 2 weeks, it's healed and barely visible. A person with uncontrolled blood sugar gets that same small cut. 2 weeks later, it looks the same, or worse, or it's starting to turn an alarming color. Diabetic wounds don't heal properly for 2 compounding reasons. First, high blood sugar directly impairs the immune cells that are supposed to rush to a wound and start the repair process. It makes them sluggish, less effective, less able to fight bacteria. Second, poor circulation means the wound site isn't getting the oxygen and nutrients it needs to build new tissue. A wound that doesn't heal is not a minor inconvenience. It is a portal for infection. And infections in diabetic feet move fast. What starts as a surface wound can reach deeper tissue, then tendon, then bone. Osteomyelitis, bone infection, is one of the leading drivers of diabetic amputation. The diabetic foot ulcer is responsible for more hospitalizations than any other complication of diabetes. Roughly 15% of people with diabetes will develop a foot ulcer in their lifetime, and up to 20% of those ulcers will ultimately lead to amputation. What to do? Any wound on your foot that has not shown clear signs of healing within 2 weeks needs professional evaluation. Do not bandage it and hope. See a doctor. Sign 5. Changes in skin color. Redness, paleness, or blue-purple discoloration. Your feet should be a fairly consistent color, close to the rest of your skin tone, maybe slightly ruddier after exertion. What they should not be is dramatically pale when elevated, deep red when hanging down, or developing patches of blue or purple discoloration without obvious injury. These color changes are the visible signature of peripheral arterial disease, the narrowing and hardening of the blood vessels that supply your legs and feet. And peripheral arterial disease is 2 to 4 times more common in people with diabetes than in the general population. Here's a simple test you can do at home. Lie down and raise both legs to a 45-degree angle. Hold them there for 60 seconds. A person with healthy circulation will show minimal color change. A person with compromised circulation will see their feet blanch, turn distinctly pale or even white, because the weakened vessels can't pump blood upward against gravity. Now, sit up and let your feet hang down. With healthy circulation, color returns quickly, within 10 to 15 seconds. With peripheral arterial disease, it takes much longer, and when color does return, it may come back as a deep, dusky red called dependent rubor. The feet are essentially flushing with the rush of blood that took too long to arrive. Blue or purple discoloration, particularly in the toes, can signal that circulation has become critically compromised. This is a medical emergency. What to do? Perform the elevation test at home. If you notice blanching, prolonged color return, or any persistent blue or purple coloring in your toes, see a doctor promptly. Ask specifically about an ankle brachial index test. It directly measures circulation in your legs. Sign 6. Swelling in the feet and ankles. Some swelling in the feet after a long day of standing is common and generally harmless. It happens to most people occasionally. But persistent swelling, swelling that's present every morning when you wake up, swelling that doesn't reduce with elevation, swelling that's been there for weeks, is a different story entirely. Diabetes damages the kidneys over time, and damaged kidneys lose their ability to regulate fluid properly. They begin to leak protein into the urine, and without sufficient protein in the bloodstream to maintain osmotic pressure, fluid leaks out of your blood vessels and pools in your tissues, especially in your feet and ankles, because gravity pulls it there. This type of swelling, called edema, can also result from diabetic heart disease, because a heart weakened by years of high blood sugar and poor circulation becomes less efficient at pumping fluid back from the extremities. Edema from kidney or heart dysfunction in diabetes is not just uncomfortable. It increases the risk of skin breakdown, reduces local immunity, and makes wounds dramatically harder to heal. The swollen tissue is chronically oxygen-starved and fragile. What to do? Press your thumb into the swollen area on your ankle for 10 seconds. If an indentation remains after you remove your thumb, what doctors call pitting edema, that is a sign of fluid accumulation that warrants investigation. See a doctor. Sign 7. Thickened, discolored, or crumbling toenails. This one gets written off constantly as a cosmetic problem. People blame it on old age, on their shoes, on not moisturizing enough. But thickened, yellowed, brittle, or crumbling toenails are often a sign of fungal nail infection, and fungal infections thrive in the environment that diabetes creates. Here's the connection. High blood sugar literally feeds fungi. Glucose in your tissues and on your skin creates a rich growth medium for fungal organisms. Combine that with reduced circulation, which weakens the local immune response in your feet, and you have an environment where fungal infections not only start easily, they refuse to leave. In non-diabetic people, a fungal nail infection is mostly a cosmetic annoyance. In people with diabetes, it's a genuine danger. The thickened, deformed nail can press into surrounding tissue, causing wounds. The damaged nail bed becomes an entry point for bacterial infection. And because the immune system is already compromised by high blood sugar, what starts as a fungal nail can escalate into a serious infection. Studies have found that people with diabetes have roughly twice the rate of fungal nail infections compared to non-diabetics. And in diabetic patients with peripheral neuropathy, who can't feel the damage happening, the consequences are substantially worse. What to do? Examine all 10 toenails carefully. Look for thickness, yellow or brown discoloration, fragility, or nails that are separating from the nail bed. If you find these signs, see a doctor, not just a podiatrist, but your physician, for a blood sugar workup. Sign 8. Foot deformities that develop over time, especially Charcot foot. This is the sign most people have never heard of, and it is one of the most dramatic manifestations of diabetic nerve damage that exists. In advanced peripheral neuropathy, the bones and joints of the foot lose their normal protective signals. Normally, pain and sensation tell you when a joint is under stress, when a bone is being strained, when you need to shift your weight. When those signals are gone, you can stress, fracture, and dislocate the bones of your own foot without feeling it happening. This condition is called Charcot neuroarthropathy, or Charcot foot, and it creates what looks like a dramatic, progressive deformity of the foot architecture. The arch collapses, the foot widens, and takes on an abnormal rocker-bottom shape. Joints that should never move start subluxing and dislocating under the ordinary weight of walking. Charcot foot often begins with swelling, redness, and warmth in one foot that looks alarmingly like an infection or a sprain, but there's no pain, or far less pain than you'd expect given how the foot looks. That absence of appropriate pain in the context of clear structural change is the diagnostic red flag. It affects roughly 1 in 700 people with diabetes, not common, but devastating when it occurs. And it is entirely preventable with early diabetes detection and management. What to do? If you notice progressive changes in the shape of your foot, the arch, or any structural asymmetry between your 2 feet, especially combined with other signs on this list, see a specialist immediately. Early Charcot foot, caught before significant bone destruction, can be treated successfully with offloading. Late Charcot foot may require surgery. Sign 9. Dry, cracked skin, especially on the heels. This one feels so ordinary that it barely seems worth mentioning. Everyone gets dry feet sometimes. But the pattern of dryness in diabetic patients is distinctive, and the consequences are far from ordinary. Diabetic neuropathy damages not just the sensory nerves that carry feeling, but also the autonomic nerves that control the tiny sweat glands in your skin. When those nerves are damaged, the skin of your feet stops sweating properly. It becomes chronically dry, loses elasticity, and develops thick calluses and deep fissures, particularly on the heels. Those cracks aren't just aesthetically unpleasant. Deep heel fissures are open wounds. They expose the underlying tissue to bacteria. They bleed. They get infected. And in a person with compromised circulation and impaired immunity from high blood sugar, a cracked heel can become a wound. The wound becomes an ulcer. The ulcer becomes infected. And suddenly, what started as dry skin is a hospitalization. Research published in clinical dermatology journals has confirmed significantly higher rates of xerosis, the medical term for extreme skin dryness, in people with diabetes compared to non-diabetics. The dryness tends to be most severe on the soles and heels, and it correlates directly with the severity of neuropathy. What to do? Moisturize your feet daily, but never between the toes. Moisture trapped there encourages fungal growth. Use urea-based creams, which are most effective for diabetic dry skin. Inspect your heels weekly for cracks. Any crack that bleeds or is deeper than a surface split needs medical attention, not more moisturizer. What to do right now? If you recognized 1 or 2 of these signs, don't panic, but don't ignore it either. Here is exactly what you need to do. Step 1. Get your blood sugar tested. A fasting blood glucose test and an HbA1c are the 2 most important initial tests. The HbA1c tells you your average blood sugar over the past 3 months. A result of 5.7% to 6.4% indicates pre-diabetes. 6.5% or above is diagnostic for diabetes. Both require action. Request these tests at your next doctor's visit, or call to schedule one specifically if these signs are present. Step 2. Do a weekly foot inspection. Sit down, use a mirror if necessary, and look at the tops, bottoms, sides, and between every toe. Look for wounds, color changes, swelling, nail changes, and skin changes. If you can't see the bottom of your feet clearly, Ask a family member to help. This is not optional if you have diabetes or believe you might. Step 3. Protect your feet immediately. Never walk barefoot. Wear properly fitted, protective footwear. Check the inside of your shoes before putting them on every single time. A small pebble, a folded sock seam, a cracked interior. These cause wounds in people with neuropathy who don't feel them developing. Step 4. See a podiatrist. Not just a general physician, but a podiatrist who specializes in diabetic foot care. People with diabetes should be getting professional foot exams at least once a year, more often if they have neuropathy or circulation issues. These exams catch problems that a patient examination would miss. Step 5. Control the root cause. Everything in this video, the neuropathy, the poor healing, the skin changes, the Charcot foot, all of it stems from chronically elevated blood sugar, dietary change, medication if prescribed, physical activity, weight management. These are not optional lifestyle extras. They are the intervention that stops the damage at its source. Your feet are the most honest messengers your body has when it comes to metabolic disease. They show the damage first, they show it clearly, and they show it long before most people expect to be worrying about diabetes. The 9 signs we covered today, numbness and tingling, burning pain, loss of sensation, wounds that won't heal, skin color changes, swelling, nail changes, foot deformities, and chronic dry, cracked skin. None of them are dramatic in isolation. Each one has an innocent explanation you can easily convince yourself of. But together, or in combination, or when they're persistent, they are your body's early warning system doing exactly what it was designed to do. The question is whether you're listening. Diabetes caught early is a manageable disease. Diabetes caught late, after years of silent nerve and vessel damage, is a different situation entirely. The difference between those two outcomes can be as simple as recognizing the warning signs in your own feet and acting on them. If this video helped you see something in your own health that you hadn't considered before, share it. Send it to someone you love who has been complaining about numb feet, burning feet, or wounds that aren't healing the way they should. They may not know what those symptoms mean. Now you do. Subscribe to this channel for more clinical, evidence-based health information that you can actually use. And if you want to go deeper on blood sugar management, nerve health, or reversing prediabetes with diet, the links to those videos are on screen right now. Your body is talking to you. Starting today, listen to your feet.